Nearly 10 million people develop dementia each year. This statistic is bound to increase to about 50 million in the year 2030. 6 million of people living with this condition in low and middle income countries hardly have access to the healthcare needed. Today on Sound Health, we will find out how to manage the condition. I'm Olasunbo Mudupe. Welcome to the show. Thanks for staying with us. It's still Sound Health on Lagos Television, and today we are looking at how to manage dementia. And I have with me a consultant neurologist, Professor Mustafa Daniel. Welcome to the program, sir.
Thank you very much. Thank you for having me.
What is the relationship between dementia, amnesia, and Alzheimer?
Well, I start with amnesia. Amnesia means loss of memory, inability to remember things.
Okay.
And normally you can have amnesia for recent events. That is, you are not able to remember things that occurred yesterday, this morning, short-term memory. That is short-term amnesia. Then, of course, there is amnesia for long-term events. That is, you can't remember things that happened long time ago. That is retrograde amnesia.
Okay.
Usually, amnesia for long-term event, the so-called retrograde amnesia, is the sort of thing you have when you have trauma, head trauma. People have a head injury. Now, amnesia for recent events is what you have when you have dementia. You see, you can't remember things that happened yesterday. You can't remember things that happened this morning. So, when you have dementia, they can remember things that happened many years ago. They can have things that, so that is, but they can't remember what happened this morning. They can't remember what happened 5 minutes ago. They can't remember what happened a day ago. That is amnesia.
Okay.
So that is amnesia. Then the other
Alzheimer.
Well, let's start with Alzheimer. Will be the last. The other one will be dementia. Dementia is just deterioration of function of the brain. The brain was normally functioning well, but it's now start deteriorating. It's no longer functioning properly. That is dementia. Majority of people who have dementia cannot remember things that happened yesterday, recently, this morning, 5 minutes ago, because the brain no longer is able to store immediate memory. They can't keep memory storage in the brain, and they can't store and retrieve it. So that is dementia.
Okay.
Now, Alzheimer's disease is just an aspect of dementia. There are very many causes of dementia. You have vascular dementia. You have Alzheimer's disease, degenerative dementia. There are many other things like Pick's disease, like other causes of dementia. But Alzheimer seems to be the most common reason for dementia in elderly people. That's why it's zeroed on. There are other causes of dementia, but Alzheimer seems to be the most.
So is dementia a normal sign of aging or mental illness?
Dementia is not a normal sign of aging. There are 92-year-old people who are still very, very sharp in their intellect, isn't it? Yeah, dementia is not a mental illness. Dementia is a disease of the brain. It means the brain is deteriorating. The brain is losing its functions. That is what dementia means. So, although it tends to occur in very old people, that the older you are, the more likely the dementia will set in. But there are times dementia can occur in young people in their 40s and 50s. So.
Many people living with this condition experience stigma and social isolation. 40% of them say they don't have access to the health care needed. What's your take on this?
Dementia is so subtle in this part of the world, and dementia tends to affect people of lower education, of lower social class, than people of higher education. So because of that, there was some thinking or some that dementia like Alzheimer was not common in Nigerians. That's what people thought. But when the Ibadan group, who really worked on this dementia in collaboration with the Americans, went into the rural area, they discovered that dementia was very common among the villagers, among the farmers, among the rural folks. So it's quite common in the rural area, among the simple folks, the less educated, the less privileged. But usually, because dementia is so subtle, they hardly recognize it as an illness. They simply say, oh, he's old, he can't remember things. So people attribute it to aging. They say, oh, he can't even remember his names. He can't. So they just take it to be like that. I think that is why dementia is subtle. People do not really know that it does exist. Although once in a while you can have people in the urban area, highly educated people who suffer this, but they are less likely to suffer Alzheimer than people in the rural area. So Alzheimer occurs in Nigeria, but it's found in the villages, among the rural folks, among the.
So is there a cure for dementia, this condition?
Dementia is a degenerative condition, but it can be managed. Usually, it can be managed when it is understood. For example, you remember I told you that in dementia, memory for recent events the brain can't store new memories. Anytime I tell you anything, you can't store it. So they won't remember what happened this morning. They can't remember even what they ate this morning. Then when they move around on their own, they cannot. Normally, unconsciously, when you are moving, your brain plots the pathways so that when you are coming back, it's able to find your way back to where. So, but people have dementia. When they move, they cannot trace that pathway back, so they get lost. When you tell them anything, they can't remember it. They cannot remember what they ate this morning. They can't remember what happened yesterday. But they are very, very good at remembering things that happened in the past because that has been stored permanently in their brain. So you find out that in the rural area, the rural farmer who is demented can still go to his farm and come back because that pathway is all part and parcel of his brain. But when it comes to Lagos, he cannot, he will be absolutely lost. In fact, within the house, that he may not even be able to find his way back to the bedroom after going to toilet, because those are strange places for him. So these are some of the issues about dementia. You know, I found out there was a patient of mine. Well, he was in the rural area. He had dementia. His son was very wealthy here. He said, "What is he doing over there? Let him come and live with us in Lagos." So he brought him to us because he had these issues. We admitted him to the hospital. Because people didn't really know that, because people who are demented, they still talk normally. He moved out of the hospital, walked away. He got lost. We started looking for him. We picked him up at Ikorodu. And then while in this hospital, he's from Owerri, he was still talking the places he was seeing, he was still liking it to his hometown. He couldn't really understand that he was now in Lagos because it's a new environment. So that if you understand, people who understand how to manage dementia knows that they can't tolerate new environment because they won't be able to plot new. But if they stay in their natural environment where they have been living all their life, then they can function to some extent. So that is the way we manage dementia. If there are other illnesses accompanying it, apart from the dementia, like depression, like insomnia, all those will be managed by the doctor. So it's very important for a patient who has dementia to be managed by someone who understands it.
So how do you care for people living with this condition? You know, if they are within their family members, how do you care for people living with that condition?
They need understanding. You have to really understand their problem. Understand that they are no longer able to function the way they used to function. You need to, when you understand, then you will be able to take care of them. There are certain things they can't do again. You have to assist them. If they are not disabled in other ways, the problem is remembering things. So you have to what usually brings conflicts at home. A lot of people who have dementia, usually there's a lot of conflict and tension in the house.
How do you prevent this disorder?
Yes, so the family needs to be educated, so that the tension that comes from the fact that the man can't remember anything again, because sometimes the family can look at him as being horrible, because sometimes we accuse you of something which you had done, but he cannot remember.
Intentionally.
He didn't. He's not doing it intentionally. It's because his brain no longer is able to retain what happened. You might have done something now, and he thinks you haven't done it. You might have told him something now, he had forgotten about it. So the family, those who are caring around, need to understand this and be able to appreciate it and manage it. If there are conditions requiring care, that is some disability, they also need to help. But a lot of demented people are functional. They move around, apart from the fact that their brain no longer can retain any new information. And this is the real limitations. And then also the family should also understand that they should not give them, they should not take them to strange environment, because once they're in a strange environment, they may be lost. They can take they would like to take the daddy on a holiday. They go to a place on a holiday and they find it extremely horrible because he's completely confused. He cannot really, but when they put that in mind, that a new environment will be strange to him, then they will know how to cope with that.
Okay, I was going to ask, can the disorder be prevented?
There are so many factors that come to play in dementia or Alzheimer's disease. There is the genetic factor. It's not you may carry the gene that at the end of the day you may have Alzheimer's disease. So if you already carry the gene, then it will come. Of course, other factors are the things like high blood pressure, things like diabetes, things that high cholesterol that causes the brain circulation to be, you have atherosclerosis, the hardening of the arteries in the brain to compromise the circulation. So this will help to aggravate dementia. So in order to prevent dementia, you have to make sure that these are well treated. If the patient has diabetes, if he has hypertension, if he has high cholesterol, it has to be treated. You have to be on a good diet, and you have to do regular exercise, and then all this will reduce the brain compromise with brain circulation. There is also the issue that dementia tends to occur in people who are low, who don't use their brain much. So you find out that a professor of medicine, a professor of mathematics may hardly be demented because it's always using the brain. So we also say one of the ways of preventing dementia is to make use of your brain all the time. So if you keep using your brain, the brain will not degenerate. So that is one. But the most important thing is that we must live a healthy life, good diet, prevent hypertension by treating it, treat diabetes, treat any disease that will compromise brain circulation, and then good regular exercise and using the brain all the time. All this can be a way of preventing dementia.
According to the World Health Organization, the number of people living with dementia is set to triple in the next 30 years to about 50 million people. What can be done to cut this pending statistics?
I think they are right because many life expectancy is increasing in many parts of the world. For example, although in Nigeria, you see, we are still a young population. Average life expectancy is 52 years, so you wouldn't really see that problem here. But when we improve the quality of our life, and a lot of people now live longer, then dementia will become an issue because these are things that come on at older age group. And as many third world countries are improving their life and their life expectancy increase, dementia will become a big issue. But of course, keeping this in mind, you can prevent it by some of the measures I have just said. Live a healthy life, do a regular exercise, healthy diet, prevent high blood pressure, treat diabetes, treat cholesterol, high cholesterol, do all that. When you do that, you will reduce the incidence of dementia, and that will cut it down at individual level and at national level.
Thank you so much, sir, for sharing your expertise with us on Sound Health.
Thank you for having me, and it was a pleasure to share my expertise with the public who are watching this program.
All right, that has been Professor Mustafa Daniels, a consultant neurologist on managing dementia. Sound Health continues with trending and home essentials. Please stay with us. That's Sound Health this week. Hope you've learned a few things about managing dementia. For comments and inquiries, please send SMS to 0818-815-3695 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.